This is a podcast by the Straits Times.
To begin with, it's hard to navigate, like who to see. There's so many different professionals, like you said earlier on, like counselors, psychologists. I mean, here I am a clinical psychologist, Cassandra's an educational psychologist. Like, who exactly should I go to? And it sounds like a lot of work that parents need to do to find out for the very first step. My personal take is that I think it's firstly important to know where the struggles are, where the difficulty lies, and that can help to determine whom should I seek out.
Hi, I'm Joyce Teo. Welcome to Health Check. So here's a question that sounds simple, but it isn't. When you're struggling or when your child is, who's the best person to turn to? Who's the best expert? Is it just a therapist, a counselor, a social worker, a psychologist? And if it's a psychologist, should it be a clinical psychologist or an educational psychologist or someone else? So importantly, how do I know if a psychologist is actually qualified to help me? I mean, this hasn't always been easy to verify, but things are about to change for the better. So Singapore's Ministry of Health has announced that psychologists from 5 key subdisciplines, these are the ones providing direct care and high-risk interventions, they will soon be registered under the Allied Health Professions Act. These are the psychologists from the clinical, educational, counselling, forensic, and clinical neuropsychology fields. This change will take a little time as the ministry expects to announce the schedule and requirements by early 2027. But it's a big step toward better oversight and patient safety. So in today's episode, we're diving into the heart of the profession. What do psychologists actually do? We'll discuss why their roles are often misunderstood and why regulating the profession is so important. We will also touch on how to make sure the psychologist you have chosen is the right one for you. And for that, we have 2 council members of the Singapore Psychological Society here with us today. They are Mr. Adrian Toh and Dr. Cassandra Neo. Adrian is a clinical psychologist in private practice, while Cassandra is a psychologist who works at a public hospital and is trained in educational psychology. Hi, Adrian, and hi, Cassandra. Welcome to Health Check.
Hello.
So let's start with Adrian first, right?
Yeah.
So Adrian, when people hear the word psychologist, they always imagine a couch and somebody taking notes, right? They think psychologists just mainly do therapy. That's probably a narrow view, right? Isn't it?
Yeah, you're right to say that, many people do think of psychologists as just do therapy. Therapy is part of the work, but it's only one part. So psychologists are trained to understand behaviors, mental processes, and depending on their specialization, they may do like assessment, diagnosis, structured psychological testing, evidence-based treatments, consultation with teams, or program designs, research, as well as training. So they do a lot of things.
Mm-hmm. But you yourself, you're a clinical psychologist, right? So does that include everything that you just described?
Kind of. So clinical psychology provide comprehensive mental and behavioral health care that includes assessment, psychological testings when needed, as well as evidence-based intervention.
Right, and we have Cassandra. She's trained in educational psychology.
Yes, correct.
So tell us about it. I mean, what's the difference, right? People, I think, might get confused.
Yeah, so I think for educational psychologists, a lot of the way we tend to think systemically. We think about the systems around the child, like the families, the teachers, the network around the child is important to think about because the child is always, with an adult, isn't it? So they will always be with someone who can support them. So we need to think about the various factors around the child.
Okay,
Yeah.
but sometimes you guys work together as well, right? Clinical psychologists and educational psychologists. Let's maybe talk about a case. Okay, let me bring up an example. Like my friend is telling me about this primary 5 girl. So at the parents-teachers meeting, the teachers report that she wasn't focusing in class. Sometimes they find her like looking out the window, daydreaming. And they said that she was the only one who couldn't complete her English and math assessment recently within the allocated time, which is why the parents were a bit concerned. And then at home, the parents noticed that she's spending quite a lot of time washing her hands and they want to take her to see someone, right? But they're not sure who. Psychologist, counselor, therapist, or where, or, Tell us in this case, who should the girl see and how you guys might work together on this case?
I think to begin with, it's hard to navigate, like who to see. there's so many different professionals, like you said earlier on, like counselors, psychologists, and there's so many different kind of psychologists. I mean, here I am a clinical psychologist, Cassandra's an educational psychologist. Like, who exactly should I go to? And that sounds like a lot of work that parents do need to do to find out for the very first step. Yeah. My personal take is that I think it's important to know where the struggles are, where the difficulty lies. Yeah, and that can help to determine whom should I seek out. In this case example, I think in every school they do have teachers that can provide support, counselors that can step in to provide some insights about some of these struggles, as well as to provide advice like, whom should you seek out. So I think a good touch point would be the counselor.
In school.
In school to begin with.
I think nowadays there's also the special educational needs coordinator in schools.
Yeah.
So usually when the child has difficulties in the classroom setting and the teacher has tried their best to implement strategies and it doesn't work, usually the special educational needs coordinator or the team that supports children with learning needs will usually be the one to step in, observe, collect data and find out what's going on for the child. But if it doesn't, then usually they will start to seek the educational psychologist to see whether or not there's any other difficulties. I think sometimes it's thinking about who's the first touch point. So because the child is in the school setting, so I would imagine that usually teachers will notice, then they bring up to their colleagues, special education needs coordinator. If they cannot manage, then they bring up to the educational psychologist, and it is up to the educational psychologist to decide what is within their scope to support. So for example, if let's say the educational psychologist can do some cognitive testing and things like that to see and make recommendations. But it depends also whether the educational psychologist has the capacity or knowledge to deal with also like the hand washing symptoms, whether they can work with the parents to think about that area. But as a professional, if you feel it's not within your scope, it's your duty to refer to someone else whom you feel can support.
So if you have a child in front of you, what do you do? Will the child be seeing a clinical psychologist first or an educational psychologist?
So I think this is also where we do overlap, where there's might be emotional difficulties that may affect learning. And in this instance, sometimes it's hard to predict where parents will bring the child to first. It depends on what they perceive to be more pressing. Yeah, if it's the hand washing that they're really concerned about, they might see the clinical psychologist first, for example, to understand what is this behavior about. Is it a style of coping? What's happening? Yeah, are there some mental health concerns that we should be looking at? But then if, let's say, the parent is more concerned about attention difficulties,
The learning,
then parents might just bring to education psychologists first. And I really agree with what Cassandra mentioned earlier on, that where we feel that, this is beyond the boundaries of my competency, I will refer to someone who's more trained in the area to deliver. Yeah. So I guess this case example is also one where there's emotional difficulties alongside with that learning difficulty as well.
So I guess maybe going back to your main question, whether the two clinical and educational psychologists will work with the same family and child at the same time, right? So usually best practice is that you may not do it at the exact same time concurrently, so as also not to confuse the strategies used, when the family try to implement strategies or the teachers, they try to implement strategies. You don't want to be having two professionals suggesting things. But if you were to see the case at the same time, you will always discuss first as colleagues and then come up with one plan to support them. But if you think about resources, usually we may not see two at the exact same time, meaning clinical and educational psychologists at the same time.
I agree. And if we were to work on a case together, we will need to decide what is the most pressing issue for this child to be able to cope with this current moment, the current difficulties. Is it about addressing things that's relating to her learning? Or is it about some of the other emotional difficulties that she's struggling with?
Yeah. So the outcome is that she's not doing her work, and the other behavior that we see is the hand washing. So where is this stress coming from that's causing these behaviors? That's what we need to tease apart and decide which route to take first.
I see, that sounds complicated.
So for example, I would imagine if you go to the private sector, then the psychologist would probably arrange a school visit, get information from the teachers, any learning support teachers, and also see the parents and get enough information about the child before deciding which route to take.
Oh, I see. They actually do school visits.
Yes, they do.
Oh,
They do. They
okay.
cannot work in silo.
I see.
Yeah.
So this is a educational psychologist or just a clinical psychologist?
If the parent go to which psychologist that they choose,
Right.
if that psychologist feel they can deal with this case and, do the school observation and think about things and decide that, yes, I can support, then they can do that.
I see.
I just want to add, I think that in general, difficulties that child face, they are complex, multifaceted. Like it can come from anywhere. It can come from a school, it can come from home. And it's important that we take different perspective, different lens. And sometimes we do need an educational or clinical psychologist on board to help us to see a different part of this picture. And that's where collaboration is important now. Because when collaboration comes in, then outcomes are going to be stronger as well.
Right. That means if you go to the private sector, if you go to one company, there would be a mix of psychologists, right? Like psychologists trained in different
Yeah, you
fields.
can find them.
There are many different kind of private practice around. Some really operates like one-man, two-man show, but some operates in bigger teams. And sometimes the bigger teams has got a mix of educational psychologists, clinical psychologists, counseling, and so on and so forth. And they might even include individuals who are like counselors, occupational therapists,
Speech therapists.
So it really depends on different clinics might offer different kind of services.
Right.
So some organizations, they want a multidisciplinary team, so they have all the different types of therapists and all that. Because if you think about assessment and intervention, you start from assessment maybe with a psychologist, and then the intervention usually you take over by the therapist.
Let's talk about the qualifications for a psychologist and for a counselor and for a therapist. Therapist seems to be such a broad term for like all kinds of professions in this field, actually.
Yeah, so if you think about speech therapists and occupational therapists, there are also, bachelor degrees in those specializations, and some of them also it's necessary to do the master's specialization in the speech and occupational therapy domain. So then they are very specific, speech deals with speech and a whole host of other things related to speech, and then occupational therapy, a lot of things like, sensory, physical, some of them handwriting. So there's a whole range of things that they can deal with. Actually, some of them also deal with, if they are trained, they can deal with emotional regulation, things that do cross over with what a psychologist or maybe even a counselor might do.
Yeah.
So it really boils down to the training and how the professional feels they can best serve the family.
I see that can get complicated. And I didn't mention earlier, there are also social workers with like counselling background. And, it just gets murky and murkier.
Yeah, it does. There are social workers out there who have a counselling background, who also have a family therapy background that people can further and, professional qualifications in those domains, even though their primary profession is, for example, called a social worker.
Right. And they can be very experienced as well and very good. So then, for the parents, sometimes you're confused, right? And who should I go to? And is it safe to go to this person or that person? And who is more effective, actually, basically?
Yeah.
I think it's back to asking that question about what's the issue at this moment that I want to deal with. Like, for example, if I am trying to deal with a family conflict or something within the family, I'll probably speak to a counselor who specializes in family therapy, who's worked extensively with families, understanding the context, the culture of that particular family.
I guess if you go back to the primary 5 girl, right? She has hand washing and behavioral, cannot learn. Let's say you dig further and you find out, there are some family difficulties going on at home for her, or maybe a family member passed away and all that, and then all these symptoms start coming out. So you need to find out what the history is. And if it's in that direction, nothing to do with the hand washing itself, nothing to do with it being dirty, nothing to do with so much like why she cannot focus. It's not about the inattentiveness, but maybe her mind is busy worrying about something else that's happening in the family. Then they might go to someone, for example, a counselor or someone who can work with the family. Or, if it's about, let's say, grief or things that it's for the child, then you might think about whether a clinical psychologist might also be able to do that work.
Wow, okay, that's interesting, but it's like, oh my God, it gets very complicated for the parent. So is that like a one-stop shop? I go to one person who can tell me, okay, maybe it's the grief, maybe it's this.
I mean, I must admit, it is a tricky thing to think about. I think parents have to do their research and think about which is the best way. In a modern context, I understand people do use AI to find out, what should I do? There's a lot to think about.
True. But we also have to admit that, sometimes when the clients walk in, we might think that the referral reason is, for example, behavioral issues. But as we dig deeper, we find that it actually is not about behavioral issues. Maybe it's something deeper. Maybe it's an issue that he or she struggles with. And then, the whole treatment might look very different as well. Or the psychologist or the counselor might need to refer to someone else. Yeah.
So actually, I think the onus is not mainly or solely on the parent to make the right decision, right? When the parent comes to a professional, be it psychologist, be it counselor, it is the professional's role to ensure that they can provide the best option for them. And if they feel that they can't, it is their duty to refer to the right professional or suggest the right pathway for the parent. So I think parents and caregivers out there shouldn't be afraid to look for the one that they think is the one, and don't be afraid to think that it's going to be a wrong place or the wrong person, but that trusting that the professional who is, registered and regulated, that they should, the onus is on them to provide the best outcome for.
Okay, great. So this brings us to the topic of regulation. So because Singapore plans to regulate psychologists to ensure that psychological care is delivered safely and effectively. Let's talk about that. Is it going to get easier for parents after psychologists are registered? Easier for parents to find the trained professional?
Yeah.
But in the meantime, what do they do?
Okay. I think first is understanding if this person is linked to a professional body. For example, the psychologists, they can actually be a registered psychologist with the Singapore Register of Psychologists under the Singapore Psychological Society. Yeah. And in there, the SRP, actually, they do a lot of work in screening and understanding if someone has the appropriate qualification and training to be registered. So in a way, the SRP actually did the filter for you. And that, the people on the list, they are regarded as qualified. So the first question to ask is this person qualified? Is this person received appropriate training? And then I will ask about specialization. So are you a clinical psychologist? Are you an educational psychologist? And does that fit to the issues, the struggles that I am having at this moment? And I will start a conversation with this potential psychologist and ask questions like, what are the cases that you typically handle? Some psychologists only work with children. Or some psychologists avoid children, for example, or avoid the older adults. So I think it's important to understand what are the cases that this psychologist work with. Like, does he or she do more or enjoys doing anxiety cases, mood issues, adjustment, personality disorder? And sometimes understanding this helps to avoid mismatch. Okay. And another point is also about fitness as well. There's maybe 10 psychologists in this room, but it doesn't mean that you'll be comfortable with all 10 of them. And I think when you go for your first session with the psychologist, some of the questions that I think we want to ask ourselves is, do you feel understood when you speak to this person? Do you feel safe sharing some of your personal experience? Or do you feel respected and not judged? And this therapeutic alliance, this relationship is very important. It's important for growth. It's important for that process of healing as well.
That's very interesting. So you kind of the client does her own little interview as well.
It is true. It is true.
Yes. That involves work, right? Rather than say you are used to going to the GP, just go in there, tell him your problem, and then that's it. Expect him to answer all the questions, or if not, refer you, right?
Yes.
Send you to the hospital. I guess for mental health care, we have to do a little bit more work.
Yes, we do.
I mean, as mentioned before, after you found out that the professional is registered and qualified, right? Don't be afraid to step forward and, find one and then speak to them. Like you mentioned GP. The GP will assess, right, the surface issues. And then after that, when they feel that, you need specialized help, then you find the right specialized help that's necessary. So let's say you see an educational psychologist first and the ed psych who feel that, this is not my scope, then they should refer to the right specialization to do the work.
I see. Okay, so with registration, I guess this will get easier. Because right now, that may not happen, right? Say if you're in an outfit with a few psychiatrists and then just one psychologist, you may not do it.
It's true.
I think registration will make things clearer, give people clarity and confidence that who you are seeing, upholds the ethics, upholds the scope of what they can do and what they cannot do as well.
So let's talk about the other psychologists that we have in Singapore. You mentioned neuropsychologists. There are also sports psychologists. What else and what do they actually do?
So there's clinical psychologists that looks at mental well-being, mental health issues. There is also the neuropsychologist that looks at, the brain and brain injury. How does that affect cognition? How does that affect functioning? And there is the industrial and organizational psychologist that works very closely with organization to improve on the well-being of its employee.
So in Singapore, we have counseling psychologists.
Yes,
There are counseling psychologists out there. Yeah. It's for like self-growth, personal growth. Try and some people who maybe have difficulties in their career, they might go and talk to a counseling psychologist.
Right, okay. And there are also forensic psychologists.
Yeah, forensic. So I would imagine forensic psychologists, they will work with the, forensic sector.
The courts.
The courts.
Yeah.
Sports
psychologists, they work closely with athletes. And in that process, helping them to improve performance. I think sports psychologists will work very closely with the clin psych as well. Because I think athletes, it's not easy on them. It's not just about the performance, but it's also about stress. Not just stress from that performance, but stress outside the sports itself as well, and everything adds up. Yeah, so I do see a lot of sports psychologists working very closely with clinical psychologists. Yeah.
And then there is also research psychologists out there. So some of them, they do have like a postgraduate degree, doctorate degree. They are the ones who support the evidence-based practice. They are the ones who do the research so that we know, what the evidence says. Yeah.
Oh, that's quite a lot.
Yeah, and they tend also sometimes to be in universities.
Okay. But I think these are still the minority, right? So most of the psychologists out there that people see are clinical psychologists and educational psychologists.
Yes, clinical psychologist is a big portion, and that's followed by educational, then counseling psychologists. Yeah.
Okay.
So these are the top 3 in Singapore.
So you mentioned the Singapore Psychological Society, you have your own register, right? How many psychologists are registered right now?
At this moment, we have about 800 or so psychologists who are registered with the SRP.
And what is the total in Singapore right now?
Well, that's hard to determine. For those who did not register, it's hard to tell who's out there. Yeah, but I would say that, we accounted for most of the psychologists in Singapore.
We have quite a lot of full members whereby they do have at least a bachelor's in psychology, full membership.
Oh, okay. So you just need a bachelor's in psychology.
To be a member of the society, but you may not be on the register.
What kind of qualifications do you need to be a registered psychologist?
Well, to be a registered psychologist with the SRP, at this moment, we do need a postgraduate training in psychology, and specifically in applied psychology. Psychology is really wide. You have psychologists that focus on research and so on and so forth, but we are looking at application. And I think the SRP was formed for the purpose of protecting public, to help them to be clearer about who you're seeing. So we're looking at applied psychologists.
Meaning in a face-to-face setting with the client.
Yes, that's right. So that can include like clinical psychologists, educational counseling psychologists, we have neuropsychologists. Yeah, so that's the least that we have at this moment. And we've got some other subspecialties as well.
Right, okay.
Yeah.
So if you're doing your training, you haven't graduated, you can't be a registered psychologist.
Correct.
That's true.
And you have to have placement component as part of your training as well.
Yeah.
Placement as in a training in an actual clinic.
Yeah, being in the field, you call it, like to see clients, to be in schools, for example, if it's as required per your specialization.
Yeah, most of our postgraduate training are like from 2 years to 4 years. It depends on the country, it depends on programs. And it's not just about academic work through that 2 to 4 years. It includes things like research components as well as placements. So placements are where you are being placed in a specific place for practice. Yeah, I remember mine, I went to places like the Singapore prisons, where I was there for 6 months to work with inmates. Yeah.
Okay,
So that was a very meaningful opportunity that I had. to work with this group of individuals to deal with some of the struggles that they have. And there are also other places like in a hospital setup as well to work with specific population.
My placements were in special school settings, mainstream school settings, primary schools, secondary schools, but also even within the school setting, I might see a child one-to-one when necessary, and then that will be considered like a one-to-one setting versus working with the system. But we're out in the field practicing, and there's always a supervisor who you can discuss your work with and ensure that your training is on track. So while I was on training doing all these placement work, my title was trainee educational psychologist. So I would introduce myself that way.
I see, which is why registration is important, right? I mean, it's also to prevent harms, right? But what are the possible harms that can come to a child or an adult seeking help?
I agree with you so much that, registration actually helps to minimize or mitigate the harm, the risk that's involved. And I guess your question is, what kind of harm have we seen so far? Yeah, I mean, we have received feedbacks of different kinds, some of which includes like psychologists practicing beyond their competency or areas of their expertise. If there's no registration, there's no one governing psychologists. Who's to say that this psychologist is wrong? And as a psychologist, when I do that, so what if I do that? There's no consequences.
Right.
So like, for example, psychologists providing medical advice that's beyond their area of training, or psychologists overcharging, or there's a breach of confidentiality. Yeah. All these are some of the common issues that's being reported as well. Yeah.
What do you mean by medical advice?
Medical advice, like for example, I think you look like you're doing better. You think about, maybe taking half a tablet instead of a full.
Oh, but you're not a psychiatrist.
I'm not a psychiatrist. I'm not a medical doctor.
Yeah.
Like, who am I to give such advice? It would be inappropriate. Yeah. So there are feedbacks as such where psychologists tries to be a know-it-all. Yeah. Or psychologists suggesting that, you should go on this diet.
Yeah.
And, we're not dietitian either.
Right.
Yeah, and that's really stepping beyond the boundary of your expertise.
There might be other more nuanced things, that patients may or may not know about. So, for example, if let's say you're working with someone with anxiety, there are certain steps and methods to work on. And if you accidentally, help them to use accommodating strategies rather than challenging the anxiety and the behavior, the outcome of that would be not meeting the goals of improving from their anxiety. It might be tricky because the patient might get worse.
Right, as in like their issues are not solved and then the anxiety becomes worse.
Or their anxiety might be maintained instead of getting better. And this is quite nuanced because you can't really see it. And it's a very small steps or small progress or too little progress within a certain time period.
True. So these are potential risks if, let's say, psychologists are not qualified, or individuals who call themselves a psychologist and they're not qualified to practice. They may miss all these nuances. They may not see this as a concern. But as qualified, trained psychologists, they have to refer to something that's evidence-based, based on research. I'm providing this treatment. Not just because today I feel like this, and therefore I think you need this. Tomorrow, no, I think you need something else. It's not just about mixing and matching, but
right.
I think we base a lot of our work on science. Yeah.
So that's why it's the postgraduate degree is also very important to have the research component. We're all required to do like those personal theses and write up. The research component helps one to have a better understanding of what research means and how to look out for evidence-based practice versus also practice-based evidence out there versus, trying anything that may not have an evidence.
Right. Okay.
And if I can add, there are also individuals out there whom the public thought is a psychologist. I think that can potentially lead to harm if we can't differentiate who are the trained professionals and who are not.
I see. So differentiating that, meaning looking at the list of psychologists who are registered under SRP, Singapore Register of Psychologists.
Yes. At the moment, it's still voluntary. If you don't find them on the SRP, you can ask them for where they did their degree and look on their home country's list. Those home countries will also have their own list So, for example, if you're from the UK, there is a Healthcare Professions Council that governs all these therapists and psychologists. There is also, I believe, Australia, US, and the other countries as well. They will all have their own list.
I see. Wow. Okay. So hopefully when we regulate psychologists, it'll get easier for the public. Yeah. But then that brings me to another question. And what does that mean, right? So for patients and parents, right, well, like say my $200 or $300 an hour session becomes even more expensive.
Well, I think that it would definitely increase your operation costs. But whether this cost is on the clients, it really depends from clinic to clinic, organization to organization. Yeah, so that's hard to tell.
Yeah, I think in the private setting, it might be more difficult to regulate that. But I must say that because of the long years of training where a psychologist comes to, there are reasons for like a certain market rate. I must add also that to be a registered psychologist and to be ethical and continue your practice, it also means that the psychologists themselves have to ensure that they have appropriate supervision to continue their practice. Because no psychologist should be working in silo.
Oh, so you can't just, I'm a psychologist and I set up shop just by myself.
If you are registered, you can, but like the outcomes of your work,
not ideal.
Not best, you should always at least have peer supervision.
I guess in some private practice, yes, you might run on your own, but you may engage the service of a supervisor to discuss your case, to reflect, to learn in that process. Because if a psychologist thinks that I'm good enough, I don't need a supervisor, I don't need to go for extra trainings, this psychologist won't be able to develop professionally.
Yeah.
It's doing disservice to
the clients.
To the clients.
True.
One point that I thought that I'd like to add as we discuss about seeking out for psychologists, it's not about seeking out the best psychologist, but really it's about finding a psychologist that best fits you.
It's good to know. It might be intimidating though for the parent or the person seeking help when you're already not feeling so well.
Yeah, probably, asking for the qualifications and finding out what their scope of practice is, whether they can do a certain type of therapy that you're looking for. And, if you do your research, for example, there are some sort of gold standard therapies, right? If you think about things like anxiety, low mood depression, behavioral difficulties, the evidence tends to lean towards cognitive behavioral therapy approaches. So, someone who is able to deliver those kind of practices would be suitable for those presentations, for example.
Okay. I guess it just means more work. Like you really should do your own little homework first, right? Before you see someone, and don't think that that's going to be the best person because, give yourself some time to actually figure that out.
Yes, but at the same time, then that's why we say if you have someone on the register, it is also their duty to ensure that they can do the work in an ethical manner. It goes both ways. It's not all on the parents.
Okay, that's good to know. And you were saying that most of the psychologists in Singapore, they are on the register, right?
That's true.
There's 800. I think as the registration comes, people are realizing they have to get on.
Right. So thanks for your time, Adrian and Cassandra. That was great, helping us understand what psychologists actually do.
Thank you.
Thank you for having us.
Well, that's a wrap for Health Check, a podcast series by the Straits Times. Don't forget to follow Health Check for free on your favorite audio apps, Apple Podcasts and Spotify. Like us and give us a rating. This episode is edited by Amirul Karim. Thanks for listening.
Send your feedback to podcast@sph.com.sg. Find us on Apple Podcasts, Spotify, or within our Straits Times app. Thanks for listening.